We're back with Grazel Garcia from Grazel Garcia Psychotherapy. How are you doing, Grazel?
I'm doing good, Scott. It's nice to see you here.
Nice to see you too. So today, I thought I'd ask about something that I don't know it can feel a little bit strange if you're coming into therapy for the first time and your therapist sitting there with a clipboard. So why do you guys kind of take notes during sessions? What's the point of that?
I can answer that question in two different ways. The first session usually is an intake session, which means we're gathering a lot of information about your history and what are important things for us to take account for. Um, and because it's gathering of history, it's a lot of information, so we need to write it down.
Mhm.
Some therapists, though, like for myself, I have a questionnaire that I have them fill out before they come in. That way, I'm not writing things down and I have their answers already set for me to look at a later time.
Yeah.
So it really depends who you're working with. But to answer that question, it's important when we're taking history.
Mm.
And sometimes we do write notes because there's an important memory or an important information that was shared that we need to go back to every single time as a way to anchor the work that we do in therapy.
Okay. So yeah, it makes sense in the intake process to make sure you've got everything you need written down. It sounds like your process is actually quite good in that that's all provided beforehand. So then you can actually do the work a bit more in the first session. Does that sound right?
Yeah, I try to get rid of the gathering of history before I meet with them so that I can use the time more efficiently to just be attuned to what they're needing. So we're not doing a lot of intake questions. Yeah.
Yeah. No, that makes sense. Um, and you mentioned just a moment ago about anchoring. What do you mean by that in like a therapeutic context? So someone says something and you need to anchor it.
Right. There's certain memories that we have or experiences that we have that are more important than others. So if as a therapist, we're trained to listen for those things that are so important that maybe the patient or the client may not be clocking, but we have to start writing them down just for the sake of going back to that point of memory, right? And it's always good to use it as an anchor, meaning this is where your current behaviors are probably stemming from because it's a very deep memory that probably created ways to maneuver the world that may be maladaptive now for the client.
Yeah, that makes sense. Because obviously, as a therapist, you're seeing a lot of clients. So I'm guessing you refer to the notes between sessions before the start of every session just to kind of refresh yourself on things, or do you find you can remember? Maybe I'm wrong.
Oh gosh, I have a pretty good memory, so I don't really write notes unless I really need to. I write more notes when I'm seeing couples more so than individuals.
Okay.
Um, but the notes that I write are very minimal. And yes, I have to go back to it to prepare for the session. So just looking at it, okay, what happened last session? Let me look at the most important thing and then refer it to the current session that we're going to have. But most of the time, because I don't write notes, because the emotional attunement in the session is more important to me than me writing notes down, um, I don't have to go back. I just remember, okay, this is what we talked about last session, and it's connected to the overall anxiety or depression or trauma that they're looking at healing.
Yeah, that's something I was kind of interested in actually because I can imagine in an EFT session because I know you focus on EFT. That's going to be something that surely there's not that much note taking that even can be done in a session like that. Is that right?
Um, yes. So for the notes that I take when I need it, I'm probably writing one word. I'm not writing everything that the patient is telling me. I'm
Mm,
just writing very important notes that I can anchor from.
yeah.
Um, so it may be a buzzword or an activating word that I need to attune to. Um, so yes, you're right. I don't have a lot of time to write notes verbatim and narratives on my notes. So if a client's asking, what are you writing down? I'm writing something very minimal that may not even make sense to you. Right. It's to the benefit of me, and
Yeah.
it's probably one word here and there.
Yeah. I mean, would clients have access to the notes so they know what you're kind of writing about them if they ask?
No, not to my psychotherapy notes. Psychotherapy notes are for the therapists only. Um, Progress notes are for the clients, which is very vague and minimal. It just kind of gives information about the topic that you brought in and um let's say, it's an occupational stressor. It's going to write occupational stressor and the interventions that I used
Yeah.
and the plan for the next session. It's practically very based on progress and nothing else. So
Yeah.
they have access to that.
Yeah.
Um, but it's dependent on the reason why they want the access to
Hmm.
the notes. Because we, as a therapist, we have to be careful about providing you with the notes just in case once you have it, I want to make sure that you're protecting it. And then also, once you have it, let's say you're going to show it to a trial, for example. If you pull your notes for the purposes of being in a court trial, then um, the other part of the trial, the defendant or the plaintiff, they have their attorneys will have access to all of your notes.
Mm.
So it may implicate you. So it really depends. And some clients don't know this, and that's our role is to make sure that we're providing you with all of the important information to protect you and to keep you safe.
Yeah, yeah. And safe in the legal sense as well, by the sounds.
Yes.
Yeah. Just one more question on this, I guess. The kind of stereotype I think a lot of people have coming into therapy, particularly if it is going to be one of those long intake sessions where a therapist is writing down quite a lot, it can feel quite intimidating, or I don't know, feel like you're being grilled. How do you get away from that in your sessions?
You know what I usually do? If I do have to write notes down, I usually ask the client, how would it feel if I start writing notes down in front of you right now? And if they say it doesn't feel good, it feels awkward, it feels uncomfortable, then I'm not going to do it. If they say it's okay, then I really want to check in what it means for them to say okay, if they're just kind of saying it to please me. If they're not pleasing me, then okay, I'll do it. But try to stay away from writing notes. But again, some therapists might need to write notes because, again, if we're talking about neurodiversity, we all think differently and we all have different level and capability of remembering things, and there's nothing wrong with that. And if your therapist is writing notes because they really want to remember what you're saying, I don't think it's a bad thing. It's actually a good thing if they really want to remember what you're saying because their memory doesn't serve them that well.
Yeah.
So we want to just be open to that too, right?
Yeah. Yeah, and what do you do with the notes between sessions? Are they locked away in a filing cabinet or do you destroy them?
For my psychotherapy notes, it's locked away for me. And both for progress notes and psychotherapy notes, it's HIPAA compliant. Our patient platform is HIPAA compliant. It's protected. My email platform is also encrypted, although we don't keep notes in our emails, but everything is password protected, encrypted, HIPAA compliant, and my psychotherapy notes is so different for me because again, I I have good memory and I meet with my clients on a weekly basis for many, many years. So I know who they are. So I don't really have to keep many notes. And it works for me and it works for the client. But if for the ones that I do have notes for, then if I don't need the notes anymore, then I delete it off my program. Yeah, but it's not kept on an iCloud, by the way. Yeah.
It's all locally stored.
Yes.
Yeah. No, that makes sense. Well, thank you so much for answering those questions. I'm sure people will find it a bit valuable to understand why note taking is even necessary in therapy. Um, yeah, I'm sure I'll speak to you again soon. Thanks.
Yeah, you're welcome.